In healthcare, not all change is planned. Some of the most disruptive moments come without warning: system downtime, unexpected outages, failed upgrades, and workflow interruptions that threaten communication, documentation, and patient safety. Yet in these moments of uncertainty, the informatics nurse becomes the steadying force. We translate chaos into coordinated action. We help teams shift from digital to manual workflows. And we ensure leaders have the visibility, structure, and support needed to maintain safe, effective care. Downtime is more than a technical event. It is a high-stakes change management moment. Understanding the change. Downtime as a disruption to normal operations. When systems go down, workflows do not just pause, they transform. Teams must rely on unfamiliar processes, increased communication, and manual workarounds. Stress rises and errors become more likely. This shift requires rapid adaptation, clear communication, strong leadership presence, technical and clinical alignment. This is where the informatics nurse steps in as the bridge. The key roles of the informatics nurse. During downtime, 1. Guiding the transition to downtime workflows. We help teams pivot quickly from electronic systems to paper, printed tools, and manual processes. This reduces confusion, ensures compliance, and protects patient safety. 2. Supporting staff. Through the stress of change. Change is emotional. Downtime amplifies that. The informatics nurse offers real-time reassurance, clarifies expectations, and helps staff stay grounded and focused. 3. Facilitating clear, consistent communication. A successful downtime requires a steady flow of accurate updates. We translate IT messages into operational guidance and ensure frontline teams know exactly what to do next. 4. Safeguarding workflow and data integrity. Manual processes introduce risk. Informatics nurses actively monitor medication workflows, order management, documentation steps, handoff communication, re-entry plans. This vigilance ensures information is not lost and patients stay safe. 5. Leading recovery and workflow. Re-entry. When the system comes back online, we oversee validation, coordinate data, re-entry, and ensure no critical information is missed, closing the loop on change. Change management strategies for successful downtime events. To navigate downtime effectively, organizations should plan for pre-planning, a clear downtime playbook, printed forms and manual tools ready to deploy, staff trained and familiar with downtime. Basics: leaders who know their communication roles, real-time support, informatics, nurses embedded on the units, rapid escalation pathways, consistent communication cycles, visible leadership presence, post-event recovery, structured re-entry workflows, debrief sessions, documentation reconciliation, review of risks and improvement opportunities. Downtime is not just an IT problem, it is an organizational change moment that requires alignment, leadership, and trust. Why this matters? Every unplanned disruption tests the strength of your workflows, leadership culture, and change readiness. Informatics nurses help organizations stay resilient by ensuring teams can pivot quickly without compromising safety or quality. Downtime is temporary, but the lessons it reveals about leadership, communication, and workflow design can create lasting improvement. Ready to strengthen your organization's downtime readiness? System downtime does not have to derail operations. With the right preparation, leadership, and informatics support, your organization can navigate disruption with confidence and protect both workflow and patient safety. If your team needs a downtime readiness assessment, workflow redesign or improvement, training for leaders and frontline staff, change management support during major system transitions, guidance from an experienced clinical informatics and performance improvement expert, Strategic Informatics Solutions can help. Visit Strategic Informatics Solutions, www.stratinformatics.com, to learn more about our consulting, training, and leadership development services, or schedule a discovery call to explore how we can support your organization.